Aveeno Moisturizing 1% Topical Cream Emollients is used to moisturize and treat dry, rough, scaly, and itchy skin, as well as minor skin irritations such as diaper rash and skin burns from radiation therapy. Emollients are substances that soften and moisturize the skin and decrease itching and flaking. Some products are used to protect the skin against irritation from wetness. Dry skin is caused by a loss of water in the upper layer of the skin. Emollients/moisturizers work by forming an oily layer on the top of the skin that traps water in the skin. Common emollients include petrolatum, lanolin, mineral oil, and dimethicone. Humectants, such as glycerin, lecithin, and propylene glycol, draw water into the outer layer of skin. Ingredients like urea, alpha-hydroxy acids, and allantoin help the dead skin cells fall off, keep the skin hydrated, and leave it feeling smoother and softer. It is recommended to use this cream as directed and apply it at the optimal time to achieve the best results. When using Aveeno Moisturizing 1% Topical Cream Emollients, be sure to follow the directions on the product package. Some products may need to be shaken before use, so check the label to see if this is necessary. Apply the cream to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. For example, if you are treating dry hands, you may need to apply the product every time you wash your hands throughout the day. If you are using this cream to help treat diaper rash, be sure to clean the diaper area well before use and allow the area to dry before applying the product. For those using this product to help treat radiation skin burns, it's important to check with radiation personnel to see if your specific brand can be applied before radiation therapy. Remember to apply the cream only to the skin and avoid sensitive areas such as the eyes, mouth, nose, and vaginal/groin area, unless directed otherwise by the label or your doctor. Take note of any areas or types of skin where you should not apply the product, and consult your doctor or pharmacist for more details. To get the most benefit from this moisturizing cream, use it regularly and apply it to damp skin, such as after bathing or showering. For very dry skin, your doctor may instruct you to soak the area before using the product. However, be cautious of long, hot, or frequent bathing and washing, as this can worsen dry skin. If your condition persists or worsens, or if you think you may have a serious medical problem, seek medical help promptly. Emollients like Aveeno Moisturizing 1% Topical Cream are generally safe to use and most people do not experience any serious side effects. However, some people may experience burning, stinging, redness, or irritation. If these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks. It's important to seek medical attention if you experience any unusual changes in the skin or signs of skin infection. While serious allergic reactions are rare, it's important to seek immediate medical help if you notice symptoms such as rash, itching, swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not listed, it's important to contact your doctor or pharmacist for further advice. Before using Aveeno Moisturizing 1% Topical Cream Emollients, make sure to inform your doctor or pharmacist about any allergies you may have to the ingredients. If you have any skin cuts, infections, or sores, it's important to consult with a healthcare professional before using this product. Some ingredients in this cream, such as preservatives and fragrance, can make your skin more sensitive to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when outdoors. If you experience sunburn or skin redness, notify your doctor right away. For those with acne-prone skin, look for the term non-comedogenic on the label, as some products may worsen acne. Also, be aware that this cream may stain or discolor clothing. If you are planning to have surgery, inform your doctor or dentist about all the products you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to discuss with your doctor before using this product. Additionally, if you are applying this cream to the breast area, consult with a healthcare professional as it is unknown if this product passes into breast milk. It's important to be aware of any potential drug interactions with Aveeno Moisturizing 1% Topical Cream Emollients. This cream may interact with other medications, which could affect how they work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with a healthcare professional before using this cream to ensure it's safe for you. If this cream is ingested, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away for assistance. In the US, you can call 1-800-222-1222 for your local poison control center. If you are in Canada, reach out to a provincial poison control center for help. When it comes to preventing dry skin, there are a few simple steps you can take. Try using lukewarm water instead of hot water when bathing, and consider reducing the frequency of your baths or showers to every 1 to 2 days. It's also helpful to keep your baths or showers short, and you might want to use a humidifier if the air in your home is very dry. There are various types of emollient products on the market, available in different forms such as oils, creams, lotions, or sprays. Some of these products may contain fragrance or other ingredients that could cause sensitivity in some individuals. It's a good idea to consult with your doctor or pharmacist to find the best product for you. Always follow their recommendations for the optimal benefits of Aveeno Moisturizing 1% Topical Cream Emollients. Remember to apply a thin layer to the affected area and gently massage it in. Use this product regularly to get the most out of its moisturizing effects. If you forget to use this medication on your regular schedule, you can use it as soon as you remember. However, do not use more of the product or use it more frequently than directed to make up for the missed dose. Make sure to check the storage information printed on the package, and if you have any questions, consult your pharmacist. Keep all medications away from children and pets. Avoid storing the foam canister near high heat or open flame, and do not puncture or burn the canister due to the pressure inside. Do not dispose of the medication by flushing it down the toilet or pouring it into a drain unless instructed. Properly discard the product when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.